Hi, I'm Kathleen Murphy, and welcome to Murf+E Unfiltered. Today I'm here with my co-host, Dr. Jia Li, and welcome to my show. I'm so happy to have you here today. We're going to be doing a little bit of a different twist on the show today because we're going to be focused a little bit outside of business and much more oriented around sports, which is a direction that half of my business is in. So welcome to the show today.
Oh, very happy to be here.
Thank you. Thank you. I remember the first time I had a conversation with you, I was fascinated by your story. So we're going to be getting into that in a moment or two. But I wanted just to kind of tee up the program today just in terms of giving people an expectation in terms of what we're going to be talking about today, just for setting the context for them. So I'm going to read this little overview here. So professionally supporting sports comes into a profession via very different paths. Today we will be speaking with Dr. Jia, as you go by, who is a physical therapist, and we're going to learn more about how his practice works. And he works with both non-athletes as well as pro athletes and people that may not be quite at the pro level, but maybe are heading there. And we're going to learn about his expertise and how it is working for not only his practice, but for those that he's in the care of. But before we get started, I'd love to hear a little bit about how you thought about going into the profession that you're in. Can you share a little bit about that with us?
Right. So before I went into physical therapy, I was a personal trainer. And I have worked in multiple different gyms, and I was an athlete myself. Okay. I played volleyball. So I always thought I always wanted to do something in the athletic world. Mm-hmm. And just by chance that as I progressed with my knowledge, I wanted to reach higher levels. Sure. And physical therapy just happened to be the next logical step.
Sure.
And what really got me in, or even considering it, was I developed some knee pain playing volleyball. And I didn't know any better. I went to the Barnes & Nobles in downtown and picked up some books on anatomy.
Good for you, right.
I saw this thing called foam roller. I did it, and then I felt better. And I just love sharing things with people that I find fascinating. So after that, in the gym, I'm like, everybody, we should be doing some foam rolling. You're going to feel great.
Love it.
And it worked. And so after that, I went to PT school. And then when I graduated, I was actually a little disappointed.
Is that right?
In the profession, yeah.
Okay, how come?
So when I got out, I learned everything I needed to learn to pass the boards. And my first patient was my mother. And she had chronic back pain. And I tried to give her everything that I learned in school.
Right.
And nothing would work. And I would watch her cry herself to sleep every night.
Sure.
Going through doctors after doctors, trying to look for a solution, and nothing was really working.
Right.
And so what I discovered was that the profession as physical therapist, as physical therapy, had been really good about treating acute injuries. Like if you sprained your ankle last week, or you fell on your hip, or a sports injury that might have happened recently. Right. They're very good about getting you back in action there.
Okay.
But when things start to linger for a while, months, on and off pain for years,
right,
the same approach they use for treating these acute injuries can no longer work. And that was the position that my mother was in.
Oh my gosh. So now what, right?
Yeah. So that's what really got me to expand my knowledge to understand the body as a whole. Like when the foot moves, what does the knee does and what does the hip does? So everything has to work together.
Sure.
And through discovering that, I helped her. And not only that, I was able to help a lot of other people going through chronic pain. And that's really how I built my practice, PhysioX. And if I say we specialize in something, it's specializing in optimizing movement as a whole. And it just so happened to work really well with people dealing with chronic pain.
Which there are so many people nowadays out there that have that, not only non-athletes, but in particular athletes. We're obviously in the Boston area, so we're about to be watching, hopefully, the Celtics win their championship game tonight. And a couple of their players have some very serious injuries. I'm sure that when you're watching them, you can probably tell from your expertise knowing where their injuries might be actually associated, and maybe even how far along they are if they're playing, whether they're actually fully healed or not. I know you spent a couple of years, is that correct, studying, was it the foot?
Study a lot on the foot. I think for the past 5-6 years, we've been doing some extensive work around the foot, changing foot mechanics. And that had really picked up some steam in the last couple of years, where we gotten recognition, or people in the professional sports really start to notice.
Right.
So we have worked with folks in MLB and NHL, not because they're hurt, but because of issues like, hey, when I throw, I just don't feel like I quite get the smooth swing in there.
Sure.
And our therapist, Dr. Adrian, he's actually was the athletic trainer for MLB team before he came on board to PhysioX.
Fantastic.
So he'll see these injuries, and he's able to look at the feet and say, well, the reason why you're not throwing the way you want to throw,
right,
because we're losing force from the ground up.
Okay, that makes sense.
And if we can change how your foot plants on the ground, we're able to produce force much better.
Right.
So our work with professional athletes had actually been less injury related, more movement optimizing.
And I never would have thought that. I would have thought immediately that they would be coming to you because they've got some kind of pain. So I love the fact that they are being proactive in coming to you because they notice that something's off. They may not have that pain yet, but they know that their job counts on them being at the maximum level of productivity. So any advantage that they can gain is going to be significant and could really positively impact the outcome of their performance. So what can you talk a little bit about, say, some of the athletes? You don't have to mention their names or anything, but maybe the type of sport that they're in, and then take us through a little bit of a journey in terms of the progression of they came to you with, say, for example, you were talking about working from the foot up in terms of being able to maybe throw differently. That's baseball, potentially. I think you were telling me at one point about a hockey player, and I was fascinated with that story because of the fact that they're not necessarily using traditional shoes and walking around, right? They've got a skating element mixed in, and they're using very different movement with their feet than people who are normally just walking around. Can you share a little bit about that story? Because I thought that story was fascinating in terms of what you did.
Yeah, so
to help that person.
This one particular player,
and they're an NHL player.
NHL,
right?
NHL. I wouldn't say which team.
That's okay.
Might give it away.
That's okay. No, we won't give that away.
So we got into contact through actually social media, where you saw some of the things that I was working with the foot.
Sure.
And his issue, there was no pain, but it was more like when I need to cut from the left to the right, I'm losing speed.
Sure.
I don't feel that smooth movement where I'm kind of decelerating a little bit too slow.
So they noticed that they could do that better before, and now there was a decline in their ability, or?
He was just looking for the edge.
Okay.
So he knows he's really good going from the right to the left.
Sure.
But the left just doesn't seem to flow the same way.
Right.
And so I got to look at him, and what we noticed is the left foot just happened to be stiff.
Ah.
Now, without getting too big into the science, well, your foot needs to be pliable. It needs to go into a flat shape and an arch shape.
Okay.
Well, his foot is a little stiff, and it's stuck in a more arch shape. So that means he can't absorb the force. So let's say this is your foot.
Sure.
If I put weight on it, it needs to do this and absorb.
Sure. Okay.
It's got to spring
Makes
back.
sense. Yep.
Well, he lost this mechanism of absorbing that force. And because he's a professional athlete, he's really good at compensating for whatever the body's missing.
Right.
So instead of producing the force here, he might have to crank into the hip a little bit more and move.
Sure.
So his hip's a little bit more tight, so a little bit more cranky.
Right.
And so we use some foot wedges, and I keep them in my pocket. They look something like this.
Oh,
wedges.
okay. Literally like a wedge.
Yeah.
Okay.
And we put them in certain parts of the foot.
Okay.
And we can manipulate the bones and how they move in certain segments of the foot.
That's amazing.
And once we can unlock that foot, well, the neat thing about the body, the nervous system controls everything. So if you can unlock that foot, it will use that new function on its own. You don't have to tell it to do it.
Right.
It just does it.
Right.
So once we can get that, he started moving and he goes, yeah, I can just feel more fluid. My hips just opened up a lot more.
Sure.
And I think that's something that a lot of people don't think about is that you can have great hip flexibility on a table when you stretch.
Sure.
But once your feet touches the ground, it needs to be able to maintain that. So we're not looking at the mechanics of the foot. We're really missing the full picture of how well someone can perform.
Right.
And this goes for not just lower, like hockey players,
Right.
basketball player, anything overhead shoulder athletes as well too.
Right.
The foot plays such a big role.
What about swimmers? I just thought, I don't know if swimmers would benefit from that. They're pushing off from the wall, right, when they're doing multiple laps. But is that even a thing, or do they move their feet differently if they're compensating in a different area potentially to slow them down? I don't know if this is something that you've
Absolutely.
thought about. I figured you probably had. We didn't talk about this before. I just was thinking about swimmers.
So if you have a foot that doesn't move very well, well, the way you walk is going to look very different, and how the foot moves is going to change how your bone is going to insert into the joint. So your hip position will be different based on that, and it will maintain that way too.
Okay.
So you can have a stiff hip in the water that could be addressed by doing foot exercises on land.
I never would have thought that the two would be associated. That's so cool. I love that.
Well, that's the whole beauty about looking at the body in this more holistic way of thinking about the nervous system and how everything works together versus just one piece of the pie.
Right.
And trying to target that.
Exactly. So unfortunately, like your mother, I had some back challenges. And so I ended up initially going to a chiropractor to try to make adjustments, and that was helpful, but there's a lot of swelling and such. I ended up having back surgery, unfortunately. But when I was thinking it through after the back surgery, and I hadn't met you at that point, so this is probably about 6 years ago when I had my surgery, I wonder if I had come to you and said, hey, is there something that is contributing to maybe what happened with my ruptured discs? Was something else off? That or was it maybe a car accident that I had been in or something? I don't know. When do people come to you and well, as they find out about you, instead before they have maybe a problem, but can they come to you with one problem, say, in my case, it would have been my back was in pain, and you say, well, actually, the problem is stemming from a completely different area that I never would have imagined. Let's pretend it was my ankle or something. Is that a possibility?
Oh, 100% now. And I would even argue that is the majority of cases that we see, especially with things that's been going on for a long time, over 3 months, 6 months, and stuff.
Years?
Years.
Possibly?
Oh, absolutely.
Right? Yeah.
Absolutely. I mean, the body's always going to find a way to compensate. And if you don't address it, it's just going to stay that way. Right?
Okay.
So, for example, I just treated a person right before this. He's another physical therapist.
Oh.
And he's dealing with 10 years of back issues, and it was always on the left side. But once we started doing something to the right foot, his back started to free up. And these changes are fast.
Love that. Right.
It's not like you come in, we do something, and let's do this for a month and see what happened.
Sure.
If we're dealing with the nervous system, we should see a change within the same session.
That's incredible.
That's how we know we're making the right decision as to what's going on.
That's remarkable, because I think maybe not unlike other people that perhaps have experienced maybe some physical therapy, or maybe they know somebody that has, I think they have this notion that it has to take months and months and months before you're going to see maybe results. So I had never heard anybody until you started telling me about the nervous system and the ability to, let's say, manipulate or work with it in such a way that is to your advantage, that you can get quicker results, which is remarkable. I mean, I think more people need to know about that, because we were talking earlier about chronic pain and how many people are in that, your mom having been one of them. And if you can help to solve that, it just gives people such a better quality of life.
I think, we got to give people hope.
Yes.
Especially those with chronic issues.
Oh my gosh.
They've seen
Yes.
everyone,
Right.
right? And so when our biggest goal when we first see someone is, hey, can we give them a quick win?
Yes.
Okay, you feel awful reaching down. We give you this weird breathing exercise or whatever it is, because that's what we find might be what your body needs.
Right.
And then you bend over again, and that should feel better the second time around.
Wow.
And if it does, then we know that we have made the right decision as to what's going on, or we have a better educated guess as to what's going on.
Right.
Because, there's just so many different factors when it comes to pain. There's so many different ways someone can present that can cause issues all around the body. But we want to be as accurate as we can.
Sure.
When we make an assessment like that.
Oh, without a doubt. That makes so much sense. Do you find that there's a common ailment that, independent of whether you're an athlete or a non-athlete, that a lot of people are suffering with, that can be addressed and they don't even know that it can be addressed?
So many.
I was hoping you'd say, no, there's just like one or two and we're good.
Yeah, there's
There's so many. Uh-oh.
I think a lot of people could really benefit from having better foot mechanics, but I'm biased in that way because
Sure.
I've worked with it for so long.
Does that have to do with your shoes, or are we starting with just bare feet and doing certain things? Okay, so talk to me a little bit more about that. What does that look like?
Well, if the way your foot touches the ground sends a chain reaction up the body.
Makes sense.
So if you have a foot that's more stuck in this shape and a foot that's more stuck in this shape,
Yes.
your whole pelvis will rotate in that direction.
Oh,
right.
okay.
But I'm not going to go and face this way.
Right.
I will have to counter rotate my body here, and I have to counter rotate my head here to readjust so I can continue to survive and live my normal life.
Right.
So a lot of people who's suffering from maybe like an Achilles tendonitis type issue can be turned around really quickly by just manipulating the bones of the foot.
Wow.
And I tell people this is that muscles are dumb. They only
I haven't heard that before.
they only react to what the joint is doing.
Oh, they're
So-
followers.
Yeah, exactly. So if I hold a weight and I put my arm like this, my bicep will contract, so my arm don't fall off.
Okay.
So if we can change the joint positions, we can manipulate the muscle in any way we want.
Okay. Wow.
And if we
That's
can,
powerful.
and how do we manipulate joint positions? Well, the nervous system, right? If we can change how we perceive the ground, then we have that downstream effect and affect everything else.
That's incredible. That's incredible. No, I know working with athletes, we both do, that they will very often play through extraordinary pain. And I know that has to compromise their output in terms of what their capabilities are doing. What's the science behind allowing them to be able to do that, where most non-athletes or non-pro athletes wouldn't even dream about being able to do what that person's doing in front of us, given the fact that they're in that amount of pain? What allows them to work through that? Is that something that you can talk about?
For sure. So athletes, especially professional athletes, are really good compensators. And I think that's one of the things that separates a really good athlete from someone who's not a really good athlete.
Sure.
Let's say if my shoulder's really hurt and I can't reach above my head.
Right.
Well, a normal person, they would just not do it.
Right.
An athlete, they might find other ways. They might go do this, do this, do this. So they go
To
crank.
get there. Okay.
They'll crank into parts that's much more robust and healthy, like their back,
Right.
to perform the movement that they need to perform.
Okay.
So you will look at them, they're like, yeah, they seem a little bit off, but they're still doing it.
Right.
And that's what makes them professional athletes.
That's right. How do they deal with the pain, though, of being able to go to that level where adrenaline. Okay. So do they have more of an ability to tap into that, or is that just a natural outcome of calling for it when you need it from your body?
I think I think it is more just it comes from within, I believe.
Okay.
But I think you would have maybe a better answer to that. I would love to hear what you think about that. Because as an athlete, if I'm in there and I know my team is relying on me to perform, I wouldn't even say something is hurting me. I can deal with this afterwards.
So I have seen that many, many times with the sports teams and athletes that I work with at the college level, and then when I'm watching pro sports, seeing what they're accomplishing without knowing maybe what some of their ailments are. I typically know what some of the ailments are of the athletes that I'm working with, and I've seen so many of them, particularly ones with back issues, shoulder issues, hip issues, knee issues. Do things that are extraordinary, things that I can't even explain how they're doing it, given what I know their injury is, and that maybe they're not fully healed yet, but they're either not coming clean to their coach or to their trainers and telling them how much pain they're actually in, but they'll sometimes admit it to me. Of course, I don't tell anybody else because that's sacred knowledge, and I'm not going to give them up if they think that that's to their benefit not to tell other people. That's their decision. But it's remarkable to see what the body is capable of doing, particularly when somebody feels responsible for other people, that what they're doing is going to contribute to the health or well-being of the rest of the team. They will sacrifice and put up with beyond immeasurable pain that others that aren't at their level will tolerate. They just can't do it. And I find that really impressive because I think that carries over when I see them go and transition from being a college athlete into the working world. I see generally, and I don't like to make generalizations, but this is a good generalization, that so many athletes are so successful in whatever field that they choose to go into. And I think it's because of their ability to power through pain and to work for the good of others, to help them to achieve whatever it is that they're trying to achieve together. And I'm always so impressed. I love watching the trajectory of when athletes move into the professional world to see what they're capable of doing.
Yeah, I think there is something about serving others that really draws in some intrinsic motivation. The majority of people that we see, general population, people with chronic issues, and most of these people are very busy.
Yes.
Busy parents. They
yes.
have this schedule is crazy.
Yes.
I don't know how they do it.
No, they don't sleep or something.
They don't sleep, but they just power through all of that because that's what's required of them.
Right.
And
they don't complain.
They don't complain.
That's remarkable because I'm sure you've seen a lot of people that actually do complain a lot.
No, even
okay, good.
We have to pry it out of them.
Really?
We have to pry it out of them. We have to ask a lot of questions to really find out. And it's like, yeah, how long you been dealing? Oh, yeah, dealing with this for the last 20 years. I was like, oh, that's the first time you mentioned that.
Wow.
So our thing is, look, you have to tell us all the different things that's not feeling great because these are puzzle pieces that we need to use to find a solution.
Right.
And sometimes it's so funny that someone will almost forget that they have this painful thing.
Right.
So, oh yeah, I had a surgery in my left ankle. Oh yeah, I forgot about that.
Right. Exactly.
And it's just fascinating how, as humans, we can almost dissociate us from those things for the greater good of taking care of our kids, for the team, or whatever it is.
To accomplish whatever it is that we need to accomplish, which is, I find that remarkable about just us as humans, that I think that we're so much more capable than we think that we are of accomplishing things. It's just how much willingness you're going to put towards any kind of sacrifice, whether that's the pain that you're having to sacrifice, the time, the lack of sleep, whatever it is that is going to require you to muscle through and get there. And we've both seen witnesses of people that have done that on a routine and regular basis that I just marvel at, and which is one of the reasons why I just love, and I'm sure you love working with athletes and pro athletes, just because it's inspiring to me. I mean, I don't want them to be, in so much pain that it's going to disrupt and hurt their life going forward, to have the proper life that they should without being in chronic pain like that. But knowing that you're with us and your practices here gives, like you said, people hope, and it gives me hope to think that there are solutions.
I mean, the mental side is so big too, right?
Enormous.
I'm sure I would love to get your opinion on this. Is that when you don't believe something can be done about your injury, well, that already shuts you off from the possibility of healing.
So true.
So one of our obstacles so that's why it's so important to give people a change in the first session. Is I want to give you that hope.
That
right
quick
away.
win.
Open up that door for the possibility that things can be better.
Exactly. And I would love to, I know that you have your own podcast. What is your podcast called?
I call it Tea Time at PhysioX.
Nice. I love it.
We sit down, we have some tea, and we just talk.
That's fantastic. Well, I'd love to be a guest on your show, and perhaps we can talk more about the mental health aspect. That is something that I also get into a lot with my clients, both on the business side and the sports side. But this podcast today has just gone by in record time. My gosh, it seems we just started talking just a few moments ago. I want to thank you for being a guest here today, and I'm going to be winding down, and I want to thank everybody for being here with us today. Stay tuned to join us again for many more future Murf+E Unfiltered shows. Thank you for being here today, and thank you, Dr. Li, for being with us, or Dr. J, as you like to more informally be called. So take care, everybody. We'll see you the next time.
Thank you so much.
Thank you.